Hello everyone, Dr. Wayne Smith here at Family Chiropractic in Statler. Today I want to talk about knee pain, and more specifically when knee pain isn't actually knee pain. And in order to demonstrate this, I built a little model here. I actually went a little overboard, spent about a half an hour doing this with my kids' Tinker Toys. In my perfectly anatomically correct model, you'll see the femurs here, the tibia and fibia with the articulating knee, and the beautiful feet down there. We have a pelvis, and we have 5 lumbar vertebrae up at the top. But I want to talk about knee pain. There's lots of ways that you can injure your knees. And usually that happens with kind of a twisting motion here at the bottom. And you compromise one of the ligaments there, the ACL or the MCL, sometimes the meniscus are involved. And that happens when there's trauma or force or a twisting action to the knee itself. But there are times when your knee suddenly starts hurting and you can't figure out why. You don't recall doing anything specific. And sometimes that's because the problem is not in the knee at all. Sometimes the problem is actually up in the lower back. When you have a restriction or an irritation in the low back or the pelvis, what it will do is change the way that the mechanics work everywhere down from that area. So if you can imagine things are tilted slightly to one side or another, or things are stiffer on one side or the other, it's going to create an imbalance which causes you, when you walk, you're going to be walking a little bit differently and putting more stress on the knees in different areas. Now, it's not enough stress to cause a tear or a specific damage to the knee like you would have in the case of an ACL tear or a meniscus tear, something like that. But it is enough to cause stress on those various ligaments that it's not accustomed to. So the result of that is knee pain that crops up suddenly that you can't really explain. And so when that happens, I encourage you to go to a chiropractor and get things checked out, because many times the problem is not in your knee at all, but it's in the low back or even sometimes in your feet. Because anytime you have the mechanics changing throughout that whole system, you can cause some extra stress on those knees, which will give you that pain that you're feeling. I'm Dr. Wayne Smith from Family Chiropractic. Thank you for watching.